Hello everyone. In this class, we'll try to learn about what are the events that take place during each cardiac cycle. The learning objectives of this class would be to define cardiac cycle and list the phases of cardiac cycle, draw the diagram depicting changes in left atrial ventricular pressures, aortic pressures, left ventricular volume, aortic blood flow, JVP, heart sounds, and ECG of a cardiac cycle on the same table scale. Describe various electromechanical events of cardiac cycle and understand the pressure-volume relationship of left ventricle. Cardiac cycle is defined as a sequence of electrical and mechanical events occurring in heart during a single beat. The phases of cardiac cycle consist of atrial systole, diastole, and ventricular systole and diastole. The atrial diastole is merged in ventricular systole. Therefore, the events of cardiac cycle, they are described in mainly three phases, that is aortic systole, ventricular systole, and ventricular diastole. So this is the diagram showing of the atrial events, that is atrial systole and atrial diastole, and subsequently it is showing ventricular systole and ventricular diastole. If you note the timing, the time duration, the time required for one cycle is 0.8 second, and the atrial systole requires 0.1 second and atrial diastole is 0.7 second, whereas ventricular systole is about 0.3 second and the ventricular diastole is about 0.5 second. So these are the different phases of cardiac cycle. That is here predominantly the ventricular cycle I mentioned. It consists of ventricular systole and ventricular diastole. Ventricular systole further divided into isovolumetric contraction phase, rapid ejection phase, and slow ejection phase. Whereas ventricular diastole, they further are in isovolumetric relaxation phase, a rapid filling phase, slow filling phase, and the last filling phase, or which corresponds to atrial systole. Okay. So during isovolumetric contraction, both the AV walls and semilunar walls are closed, and because of the depolarization, there will be increase in the pressure in the ventricles. So that leads to the opening of the aortic and the pulmonary semilunar walls, which causes the rapid ejection phase and later slow ejection phase. During isovolumetric contraction, again both the AV walls and semilunar walls are closed, and ventricle starts to repolarize. So the pressure in the ventricle is going to reduce. That causes the opening of the AV walls, and that leads to rapid filling of the ventricles and later slow filling, which is called as diastasis, and later the last filling phase corresponds with the atrial systole. Now we'll try to learn what are the different events that occur in different phases. During atrial systole, this is the onset of the atrial systole coincides with the peak of the P wave in the ECG. During this period, the blood from atria enters ventricle due to the atrial contraction that completes ventricular filling. At rest, contributes to the less than 20% of the filling of ventricle. Therefore, ventricular volume curve rises slightly during this phase. So this is the Vigus diagram, which shows the different phases of cardiac cycle, that is systole, diastole, and this is the next cycle of systole. Okay, so where you also can see different phases of the ventricular systole, that is isovolumetric contraction phase, rapid and slow ejection phase. So then the isovolumetric relaxation phase of the diastole, then rapid flow, the diastasis, and the last filling phase that corresponds with the atrial systole. And you can also see the different pressure curves of the aorta, where the pressure fluctuates between 80 to 120, and you can see the atrial pressures which are in a very narrow range, and the brown color ventricular pressure changes, okay, so which ranges from 120 mmHg to 0 mmHg, and the blue line you can see the ventricular volume changes, and the electrocardiogram and phonocardiogram, which shows the occurrence of the different heart sounds. This is another diagram showing the aortic pressure in red line, the ventricular pressure in green line, and the atrial pressure in the yellow line, which corresponds with a phonocardiogram. That is the occurrence of the first, second, and third heart sound. The major events that occur during the atrial systole are: the atrial systole begins from the peak of P wave and ends with the peak of QRS complex as noted in ECG tracing. During atrial systole, ventricular volume increases mildly. Atrial pressure rises due to the atrial contraction that causes genesis of A wave in the atrial or jugular venous or JVP curve. The atrial pressure exceeds the ventricular pressure. The fourth heart sound is recorded in phonocardiogram at this phase. This is produced by inrush of the blood into the ventricles. The mitral valve closes at the end of the atrial systole, and when the ventricular pressure exceeds the atrial pressure. Atrial diastole follows atrial systole, during which the atrial filling occurs. The atrial diastole occurs with ventricular systole. At the beginning of the ventricular systole, the bulging of the atrioventricular wall into the atrium results in increase in atrial pressure that produces C wave in JVP. Venous return increases atrial volume and increases the atrial pressure. This produces V wave in JVP. The phase of ventricular systole is divided into two parts: phase of isovolumetric contraction and phase of ejection. Okay, so this diagram showing the ventricular systole. Okay, so the initial 0.5 second is isovolumetric contraction phase. So then later is a rapid ejection phase, which is again divided into the initial rapid phase and the later slow ejection phase. The phase of isovolumetric contraction. Appearance of QRS complex in ECG heralds the onset of systole. This phase starts with closure of mitral valve and ends with opening of the aortic valve. Thus, ventricular volume raises. The ventricular volume remains same throughout this phase. In spite of forceful contraction, the ventricular size, the muscle length, apparently remains same. So isometric type of contraction. That's why. Therefore, this phase is called as isovolumetric contraction phase. The major events that take place here are: this phase starts from the peak of QRS complex in ECG. The first heart sound appears in the phonocardiogram. The ventricular pressure rises abruptly from 0 to 80 mmHg in the left ventricle and to 8 mmHg in the right ventricle. The walls of the heart remain closed, therefore rise in ventricular pressure occurs rapidly without change in the volume. The ventricular volume does not change and aortic blood flow is nil. This phase ends with opening of the semilunar walls when ventricular pressure exceeds the aortic pressure. During the phase of ventricular ejection, the opening of the aortic wall, which is going to mark the onset of this phase of ejection. The phase is further divided into two parts: a phase of rapid ejection for lesser duration and the phase of reduced ejection of longer duration. The phase of rapid ejection is differentiated from the phase of reduced ejection by two important features. There is quick increase in the ventricular and aortic pressure and greater decrease in ventricular volume that occurs due to abrupt increase in aortic flow. In rapid ejection phase, during isovolumetric contraction phase, enough tension builds up in the ventricular wall. Therefore, the opening of the aortic wall, aortic blood flow increases abruptly and the blood is ejected forcefully into aorta from the left ventricle. Similarly, blood is ejected from the right ventricle sharply increases the flow in the pulmonary trunk. The ventricular pressure continues to rise sharply. Aortic pressure also increases sharply but remains below the ventricular pressure almost throughout the rapid ejection phase. A large amount, about 2/3 of the ventricular volume, is emptied rapidly in this phase, hence the name rapid ejection phase. That causes a steep fall in ventricular volume curve. The atrial pressure decreases sharply at the beginning of the rapid ejection phase due to the descent of base of the heart and stretch of atria that occurs due to strong ventricular contraction. However, atrial pressure rises slowly after the initial fall due to the venous return. The C wave is produced in the jugular venous pressure curve in the early part of the rapid ejection due to the impact of common carotid artery with adjacent jugular vein and also due to the bulging of closed tricuspid wall into the atrial chamber. The major events that occurs here are: this phase starts with opening of the aortic wall. There is a steep increase in the aortic blood flow, steep fall in the ventricular volume. Ventricular pressure increases further. The aortic pressure also increases but remains just below the ventricular pressure. Atrial pressure falls in the early part but slowly increases thereafter. The C wave is produced in the JVP during this phase. This phase corresponds to ST segment in the ECG. So, reduced ejection phase is a longer phase of ventricular systole during which both ventricular and aortic pressure decrease. The aortic pressure declines due to the runoff of the blood from the aorta to the periphery that exceeds the ventricular output. The aortic pressure exceeds the left ventricular pressure in this phase. In fact, reduced ejection phase begins at about the time when the aortic pressure slowly exceeds the left ventricular pressure. Stored potential energy in the stretched arterial wall contributes to the alteration in the ventricular aortic pressure gradient. In spite of this change in the pressure gradient, blood flow continues from ventricle to the aorta due to the movement of forward flow of blood caused during the rapid ejection phase. This keeps the aortic wall open. However, aortic flow is significantly reduced at this phase, and hence the name is reduced ejection phase. The ventricular volume continues to decrease and reaches the end systolic volume at the end of this phase. The major events that occur here are ventricular and aortic pressure decrease, but aortic pressure exceeds the ventricular pressure. Aortic blood flow is greatly decreased. The ventricular volume is further decreased. The atrial pressure continues to increase slowly due to the blood returning to the atria. The atria relaxes throughout the ventricular systole. The T wave in ECG appears in this phase. The phase ends with the closure of the aortic wall. Then coming to ventricular diastole. The ventricular diastole has two phases: the phase of isovolumetric relaxation and phase of ventricular filling. Ventricular filling phase is subdivided into the phases of rapid filling and reduced filling. The phase of isovolumetric relaxation. The ventricle starts relaxing in this phase that results in steep fall in the left ventricular pressure. During this phase, No change occurs in the ventricular volume as this period is placed between the closure of aortic wall and opening of mitral valves. Therefore, this phase is known as isovolumetric relaxation phase. This is also called isovolumetric relaxation phase as apparently there is no change in the ventricular muscle length. Due to the closure of aortic wall, a characteristic notch is produced on the descending limb of aortic pressure curve at the beginning of this phase. The vibrations set up by the closure of aortic wall produce the second heart sounds in the phonocardiogram tracing. It terminates with the opening of the mitral wall. The major event that you see here, there is a rapid fall in the ventricular pressure, but there is no change in the ventricular volume. The aortic flow is almost nil. The second heart sound appears in the first half of this phase. The atrial pressure continues to raise and the peak of V wave. The JVP appears towards the end of this phase. This phase ends with the opening of the mitral wall. Then phase of ventricular filling. This phase is further divided into rapid filling phase and reduced filling phase, that is also called as diastasis. In rapid filling phase, as soon as the left ventricle pressure falls below the left atrial pressure, the mitral wall opens. The blood that accumulates in atria during the ventricular systole rapidly enters into the ventricles as soon as the atrioventricular walls open. The major part of the ventricular filling occurs rapidly that increase ventricular volume to greater extent. In spite of rapid filling, ventricular pressure continues to fall due to the ventricular relaxation. The rapid flow of blood from left atrium into left ventricle decreases the left atrial pressure. Vibrations set up due to this rapid inrush of blood into the ventricle produces third heart sound, which is recorded in the early part of this phase in the phonocardiogram. The major events that happen here are, this phase starts with opening of the mitral wall, which corresponds to the peak of V wave in JVP. There is a rapid increase in the ventricular volume. There is a decrease in the ventricular and atrial pressures. The atrial pressure is just above the ventricular pressure here. The third heart sound appears in the phonocardiogram in the initial part. The next phase is diastasis. This phase of slow filling, this is the phase of slow filling of the ventricle. During this phase, the lesser filling occurs and filling occurs slowly. The ventricular volume curve rises slowly. The ventricular pressure and atrial pressure almost remains unchanged. It should be noted that normally a greater part of the ventricular filling occurs passively in both rapid and slow filling phase, and about 20% of filling occurs actively by atrial contraction during the atrial systole. Thus, atrial systole only tops up the ventricular volume. The major events that occur in this phase are, there is a slow rise in the ventricular volume, there is no change in the left atrial, left ventricular or aortic pressures. In ECG, P wave begins to appear towards the end of this phase. Okay. So here there is again a recap of the ventricular events which occurs during systole and which are going to occur at the diastole. So during isovolumetric contraction, all the walls are closed. There is no significant change in the chamber size. During the ejection phase, the aortic and pulmonary walls open and AV walls are closed and the ventricular size decreases due to the ejection. During isovolumetric relaxation, again all valves are closed, so there is no significant change in the chamber size. But during the filling, because the blood is going to enter from the atria into the ventricles, there is an increase in the chamber's ventricular size. And during atrial systole, further the ventricular size increases and also simultaneously the atrial size is going to decrease. And further during isovolumetric contraction, the pressure is going to increase in the chamber, so that causes the ejection phase, okay, and thus the cardiac cycle continues. This is again the Vigas diagram showing the different phases of systole and diastole, and as we have discussed, it is showing the different curves like aortic pressure changes, the atrial pressure changes, the ventricular pressure, and the ventricular volume changes with the electrocardiogram and phonocardiogram. So this diagram shows the pressure volume relationship, okay, and so the x-axis shows the change in the volume and the y-axis shows the change in the pressure, okay. So during the diastasis, that is filling, the amount of blood in the ventricle is going to increase from 50 to 150 ml, okay, and during isovolumetric contraction, uh, the blood is going to remain the same, but the pressure is going to increase, okay. So that increase in the pressure is going to open the aortic walls, that causes the rapid phase of ejection and then the later slow phase of ejection, so that closes the aortic wall, okay. And then the isovolumetric relaxation phase is going to happen when the pressure is going to fall from 120 mm Hg to almost less than 50 mm Hg. So the pressure volume relationship of the left ventricle plotted in a graphical forms uh, the pressure volume loop. The pressure volume loop has 4 phases, that is, phase 1 is the period of filling. The diastolic filling of the ventricle starts at A as mitral wall opens and terminates at B as mitral wall closes. During this period, the ventricular volume increases greatly without much change in the pressure, as this occurs during the relaxation phase of the ventricles. This phase in the pressure volume diagram begins at the ventricular volume of about 50 ml and diastolic pressure of 2 to 3 mm of Hg. The 50 ml of blood that remains in the ventricle after previous systole is called as end-systolic volume. As the venous blood of about 70 ml flows into the ventricle from the left atrium, the ventricular volume increases about 150 ml to about 120 ml, so which is called as end-diastolic volume. Therefore, the pressure volume curve during phase 1 extends from the point A to point B. So, with the volume increasing up to 120 ml and the diastolic pressure raising about 5 mm Hg. The phase 2, that is period of isovolumetric contraction B to C, during this isovolumetric contraction the volume of ventricle does not change because all walls are closed. However, the pressure inside the ventricle increases to equal the pressure of the aorta at a pressure value of about 80 mmHg as depicted by point C. So with the onset of isovolumetric contraction, the ventricular pressure rises steeply without change in the volume. The aortic wall opens at point C, that marks the onset of ejection of the ventricle. The phase 3 is the period of ejection, that is C to E. During ejection, systolic pressure still rises higher because of more forceful contraction of the ventricle. The volume of ventricle decreases because the aortic wall has opened and the blood flows out of the ventricle into the aorta. The ventricular pressure continues to rise, which reaches a peak point at D. The rapid ejection phase ends and then decreases till point E, the end of slow ejection phase. The ventricular volume decreases here. Phase 4 is the period of isovolumetric relaxation. At the end of ejection, that is point E, the aortic wall closes and the ventricular pressure falls back to the diastolic pressure level without any change in volume. Thus, the ventricle returns to its starting point with about 50 ml of blood left in the ventricle at an atrial pressure of 2 to 3 mmHg. During this isovolumetric relaxation phase, pressure falls abruptly E to A to meet point A, which marks the opening of the mitral wall. So this completes one cardiac cycle. Note the position of the diastolic pressure volume curve and isovolumetric pressure curve in the normal condition. Then effect of ventricular dysfunction. The effect of ventricular dysfunction on pressure volume loop could be due to the systolic dysfunction or diastolic dysfunction. Systolic dysfunction is the inability of the ventricle to contract. So in this condition, ventricular output is decreased due to the impaired myocardial contractility. So the isovolumetric phase curve shift to the right that decreases the stroke volume from C to E of the normal curve to the C to E of small letters of the systolic function curve. The diastolic dysfunction is inability of the ventricle to relax. So in this condition, ventricular output is reduced due to the impaired end diastolic volume. The diastolic pressure volume curve shifts upward and left from AB of the normal curve to abnormal AB of the diastolic dysfunction curve. So this decreases the end diastolic volume that results in decreased stroke volume. Okay. So here the pressure volume loop is going to show the right shift in the curves. Okay, so where in the systolic dysfunction, because of the ventricular failure, there will be accumulation of the blood, which is going to increase the end diastolic volume. Okay, and because of the dysfunction, is going to pump only the 50 ml of blood. Okay, so that is why this loop is going to shift to the right side. Whereas in diastolic dysfunction, where the ventricles are unable to relax properly, so that is why the end diastolic volume itself is low, and further because of the diastolic dysfunction, there is the increased cardiac output. Okay, and because of which the pressure volume loop is going to shift to the left side. The duration of cardiac cycle, as we have learnt, is 0.8 second when heart rate is around 75 per minute. The duration of systole is 0.3 second and diastole is about 0.5 second. In increased rate, when heart rate is increased to about 200 per minute, the duration of the cardiac cycle is 0.3 second, with the systole about 0.1 second and diastole about 0.14 second. In decreased heart rate, when the heart rate decreases to about 40 per minute, the duration of the cardiac cycle is 1.5 second, with the systole about 0.37 second and diastole about 1.13 second. So this indicates that change in the length of the cardiac cycle occurs mainly by alteration of duration of diastole. Therefore, in tachycardia, ventricular filling is greatly compromised due to the decreased time of diastole. Resting tachycardia compromises the cardiac output. So this is in brief about the different phases of cardiac cycle. Thank you.